So first, we're going to jump into some quick details about the program. We're going to talk about some major projects, career outcomes. We'll go into tuition and funding, and then we'll talk about admissions and the application. One thing I want to note before we get really into it, this program is one of several MPH programs in the University of Washington School of Public Health, and I have those listed here. There are 3 in this department. We also have the MPH in Community-Oriented Public Health Practice, and we have an online MPH program. So those are all in this department, but they're separate programs. And we do have a page comparing them. And then there are other MPH programs in the School of Public Health, but those are I'm not an expert on any of these. So I've shared the contact for each program if you want to join those. The mission of our program is to train leaders in the field of public health. We prepare students with analytical and practical knowledge and skills for improving the health of diverse communities. Our students graduate prepared to work in partnership with communities to improve the health of all people. You'll learn a common language for identifying and addressing population and public health issues and disparities, methods and principles for improving the public's health and the effectiveness of healthcare and population health services in the United States. You'll gain an understanding of the means by which social inequities and racism generated by power and privilege undermine health. And this program was founded in 1969. We're actually the oldest MPH program at the University of Washington. And we even predate the founding of the School of Public Health by 1 year. So yeah, we've been around. So these are just some demographic details about the program from the last few years, last few incoming cohorts, just for transparency, so you can learn more about what our recent classes have looked like. So in a typical year, we let in, it could be like 40, 45 students. The average size for these incoming cohorts was 41. And then international students are 17% in the last few years. This is for a few reasons. So partially it has to do with the content in this program, which there is some global health systems content in the beginning, but then it really takes a deeper dive into domestic issues in the United States and specifics of US healthcare matters. And then also our funding sources have typically been limited to US citizens and permanent residents, but we'll get into funding a little bit later on. And then Washington residents were about 65% in recent years. And then we can see students of color at 62%, and then a breakdown of how that shakes out. And then gender demographics in recent applications, the folks who've joined the program, about 78% have been women, 19% men, and then 3% either shared non-binary pronouns or didn't share at all. Okay, the format of our program is full-time and on campus. There is no online component of this degree. As I mentioned before, there is an online MPH program at UW. It's just a separate program from this one. And the length is 2 years, so 6 academic quarters. And UW, 63 credits are required to earn the MPH degree at University of Washington. And we are on a quarter system, not a semester system. So these are quarter credits. If you're more familiar with a semester system, you can think of this as like 42 or so semester credits. And 51 credits will come from your required courses. There are also 3 credits of practicum experience, which is the hands-on experiential learning component of the degree. and 9 credits of a culminating project, which is either your capstone or thesis. And we'll dive more into those in a bit here. And we offer this program in 3 tracks. We have the Generalist, the Social and Behavioral Sciences, and the Health Systems and Policy concentration. So going into each of those tracks or concentrations, first we'll talk about the Generalist. This is going to be your most flexible option to accommodate individual learning interests. Here, students will satisfy the degree requirements, and then they'll be free to take an individualized set of electives, methods, courses from the concentration offerings or other UW departments. So in this one, you're going to get the most electives. And then our social and behavioral sciences concentration. Here you'll apply social and behavioral sciences theory and methods to the study, practice, and thought of public health. You'll look at the relationships among social, cultural, and behavioral processes, health and illness, what society does and can do to promote health and prevent illness. Skills gained here will include survey research, statistics, behavioral measurement, ethnography, quality of life assessment, community-based participatory research, and cost effectiveness analysis. And then last, we have our health systems and policy concentration. This one's for students who seek a career of leadership in public or private efforts to improve the performance of the health system. You'll become well-grounded in public policy development, health economics, law, and ethics. You'll acquire a deep understanding of how and where public policy is developed, what forms it takes, who the relevant actors and institutions are, and the economic and legal forces that affect and are affected by public policy. So that was just a brief description of each concentration or track, however you want to say it. I mentioned before that the generalist one has the most electives. So we can see here, this is an example of the curriculum of what 2 years in the program would look like. And I'm also going to show you the other 2 concentrations. But what I've done here is I've highlighted what makes each concentration unique in gold. So again, in the generalist, we have 1, 2, 3, 4, 5 electives or methods courses that you can take. You're still going to have some electives in the other 2, but just less. And as I read those, the other 2 concentrations, maybe one sounded great to you, but maybe you want, a little bit of both, or maybe you want to tailor it even more to your own interests. In that case, the generalist might be the way for you to go. So other than electives or methods, I'm going to zoom out and talk about the courses that all 3 concentrations have in common. So throughout the first year, we have the PHI sequence courses. That's public health interdisciplinary. All on-campus MPH degree students across the various programs in the School of Public Health, except for those in the COPHP MPH program, they're different, but all the other ones take 6 courses as a cohort in the first year of study. And these courses address foundational competencies required for the degree. The purpose of this is to help you consider the diverse perspectives of public health and to develop an appreciation for the different disciplinary backgrounds. Students can decide whether to take a practice or research route, but they'll be skilled in both areas. And the cross-cutting themes covered are ethics and equity issues, global and local perspectives, communication skills, systems thinking, leadership and collaborative skills, and the evidence to action and back cycle. And what this does is it helps to develop a common language for understanding public health concepts across programs. We also have 2 quarters of seminar. And the seminar is designed to exchange information about matriculation and works in progress. It also functions as a forum to meet the faculty and to learn about practicum, thesis, and capstone opportunities. And then, as I mentioned, those electives credits. Okay, so now let's jump into the next. Okay, so the curriculum for the social and behavioral sciences concentration. In gold here, we can see what the required courses are. So we have strategies of health promotion, advanced qualitative methods in anthropology and public health program evaluation, health communication and marketing for health promotion theory and practice. So these gold courses are all required in this concentration, but then you'll see that you do have some electives here. You have 2 in this one, so you can still tailor it a little bit to your interest. All right, so next we have health systems and policy. So what's different here? We have the required courses for this one are health systems and policy, health policy research, health economics, and health policy development. And then we actually have 3 electives for this one. Okay, moving into talking about big projects. So first we have the practicum. As I mentioned, this is the experiential learning component of the degree. This is a planned, supervised, and evaluated field-based experience, minimum of 160 hours of work under the guidance of a site supervisor and a faculty advisor within a public health organization. And this work typically occurs at the midpoint of the program and may be conducted locally or nationally. The goal here is to integrate, synthesize, and apply knowledge and skills from the MPH classroom into a professional public health environment, gain hands-on public health work experience, and develop specialized knowledge in a topic of interest. And what you'll deliver is a written assignment, a visual assignment, and at least 2 student-generated products produced in the practicum setting for the practicum setting. The practicum projects that have come out of this program, we've had so many cool ones. There are a ton of examples on the website. If you follow this link, it gives you more details about the process of the practicum, but also a bunch of examples from different students from this program, as well as the other ones in the School of Public Health. And I think that looking at practicum projects can be a nice way of researching programs and finding the one that's best for you. Just to find inspiration and see, just like what you could be doing. Because the work that you do in the practicum is valuable to add to your resume. So it's cool to see what some students are able to add to their resume when they're in the program. All right. So the culminating project for the MPH is either going to be a thesis or a capstone. This is your last big project. So this is conducted with mentorship and support from a dedicated faculty advisor. The goals here are to develop specialized knowledge in a topic of interest, integrate, synthesize, and apply knowledge and skills from your MPH, and produce a meaningful contribution to the field of public health. So the thesis option is a research project designed to generate new, broadly generalizable scientific information about a public health issue, and it must be appropriate for publication in a peer-reviewed journal. It's not necessary that you get published, but it needs to be appropriate for publication. But we do have students that publish, so that's something exciting that can come out of these. And then the capstone is becoming more and more common with MPH programs. Here it's going to be an applied problem-solving project designed to generate a practical solution to a public health problem. And it may not be generalizable. It could be specific to one region, population, or organization. And it may or may not be appropriate for publication. For example, it could be confidential to the host agency. And we have examples of those projects here if you're looking for more inspo. Okay, jumping into career outlook. So our alumni work as public health practitioners, researchers, and leaders in universities, research and policy-making organizations, the healthcare industry, and government agencies across the United States and around the world. 99% of those recently surveyed were employed in public health or related fields. And we do have a robust alumni network. So this program was founded in 1969. We've graduated over 1,000 alumni. So this map on the bottom left just shows where some alumni have landed in the US of those that responded to that last survey. So one thing that we can do when you're getting close to graduation, you can tell us like, oh, I'm thinking about moving to, I don't know, LA. And we can, try and help make those connections for you. Though, we also see our alumni at like conferences. Some of them are faculty here. A lot of them you might meet when you're doing your practicum work or your, your major projects, seminars, that kind of thing. So yeah, it's a very robust network to be a part of. And then diving back to the pie chart on the right, these are just some industries that folks have landed in. So we can see healthcare. We have 27% of folks working in the healthcare industry, 22% in academia, 20% in government, 14% in the private sector, 13% in community health organizations, and 4% were self-employed. Okay, a bit more about career services. So the University of Washington School of Public Health actually has a career services department. They offer career advising, job search resources. They organize panel conversations with alumni for students. They give networking tips, resume guides, they do practice interviews, and post jobs. And then there are a bunch of student organizations and public health networks, and I encourage you to look at those as well, just to see, which ones might be of interest to you when you're a student here. And then there's also a University of Washington Career and Internship Center. And then I mentioned before, with this program, we have some networking with alumni, an alumni LinkedIn group, and job postings. Okay. Now we're looking at just a few career titles of some recent alumni. I know that I mentioned over 1,000 alumni, so these are, like I said, just a few. But I have these organized by first folks who the MPH is their highest degree. And then on the bottom, we have folks that also have doctoral degrees. So I won't read the whole slide out, but just looking at the job titles, we have program manager, project director, outcome and evaluation analyst, research coordinator and field operations lead, quality improvement manager, then medical officer, director, senior research scientist, professor. Yeah, I know that the, career outcomes are why we're all here. So it's nice to see that folks are doing well after leaving the program. Okay, so at this point, I'm going to get into tuition and fees. So what we're looking at now is an estimate based on the current year's rates. So this is subject to change, changes all the time, but this gives us a pretty good idea. So we are a state public institution, meaning that we do receive a portion of our budget from the state, from taxpayers. So this enables us to have a subsidized tuition rate for residents of the state of Washington. So on the left here, we have Washington residents and then non-residents. And what I've done is combine tuition and fees for the total for 1 year. And then I have multiplied that by 2 to give us an approximate degree total. And then we have a breakdown of what the fees are on the bottom. So we have the technology fee, services and activities fee, IMA bond fees, the intramural activity center, which is the nice new rec center, facilities fee. The UPass fee is going to be your transit pass. So that gets you on the bus and the light rail and cool stuff like that. So getting into some funding info. So the majority of our students finance their degree with a combination of student loans and work opportunities off campus or on campus, which would largely be assistantships like teaching assistantships, or research assistantships or student assistantships. And these can be a great way to help pay for their degree because in addition to the stipend that you would have, they also provide tuition support and health insurance. And these are jobs, so students do need to apply to them, and they can be competitive. A lot of people want to get these assistantships, but our students have had pretty good success in getting these. And they're one thing to note about assistantships is you apply to these after you have enrolled in the program. So you need, obviously the people posting these jobs want to know who they're actually weighing. So you need to have already accepted your offer, obviously applied, been offered, and accepted your offer. And they start being posted in the spring, the year before you come into the program, but they're posted all the time. Okay, so beyond this, we also have a variety of fellowships awards and scholarships available. You can see some listed here. These are available on the basis of different factors, including academic merit, financial need, and potential to contribute to the diversity of the incoming class. So we have the $5,000 H-Seed Award and the $20,000 Master's Fellowship Award. And then we have some other awards around different areas, different topic areas of study. And we have some links to find additional funding through the ASPPH, which can be a nice resource. I also really like the Graduate Funding Information Service, or GFIS. That can be a great resource for finding funding. And then applicants may also wish to contact the Office of Student Financial Aid just to see what's available to you in your situation. So we are looking ahead at the application opening up September 1st. That's when you can officially go in and start your application. And then the deadline to submit is December 1st. And then mid-February, we will convey decisions to applicants, whether or not they receive offers. By April 15th is the applicant decision deadline. So that's when, if you receive an offer, we would like you to let us know if you plan on joining us in the fall. And then late September, classes begin. So going into minimum admission requirements. So these are set by the University of Washington Graduate School. And they require a bachelor's degree from an accredited college or university in the United States or its equivalent from an international institution, and a minimum of a 3.0 GPA on a 4-point scale for the last 60 graded semester credits or the last 90 graded quarter credits. And there is the UW grade calculator linked here, which you'll have in the PDF slides that I send out if you are looking to calculate your GPA, your recent GPA. All right, so getting into how we do admissions review. So we have a holistic approach to admissions, which I'm sure you've heard from other universities in recent years as well, which is a good thing. It's part of our commitment to equity, diversity, and inclusion. So we train our faculty reviewers on the principles of holistic admissions review. And we use a standard rubric to make sure that the reviewers are rating applicants fairly and equitably. So everybody gets, the same, they're judged on the same factors. So when we do this review, these are some of the criteria that we balance as we consider the whole applicant. So none of these are total make or break factors. But first, we look for applicants who have a clear passion for public health. So you would convey this to us with your resume, CV, and also your written statements. And we look for strong academic background. This is a rigorous program, so we want to see that you can succeed. I mentioned the minimum GPA metrics before of what the UW graduate school has set. when we look at the average recent GPA of folks who have received offers, that average GPA of folks who've received offers is 3.57. That does not mean that that is a minimum cutoff. Like I said, it's just, it's an average GPA, but it's, you know, something to keep in mind. And we look at strong letters of recommendation. These are an important component. I'll get into it in a bit, but you'll submit 3 letters of recommendation. So we'll get into a little bit more about that in a sec here. And then we look for your prior work and volunteer experience, making sure that it sets you up for success in this program. And then we want to see that the career goals make sense. So basically with these last 2, there's a fit between your past progression and training and your ultimate career goals and what we can actually offer you in this program. And then one thing to note is that you do not have to do a faculty interview as part of the application. There will be plenty of opportunities to connect with faculty once you're an accepted applicant, but it's not a hoop that you have to jump through at this time, you know, as an applicant. So how to apply? You'll complete applications through both Sophus and the UW Graduate School online application portal. So these are 2 online application portals. There are 2 parts to this application. When you are setting up your applications, please use the same name and email address on both application portals. It won't disqualify you if maybe you sign up as Bob on one and Robert on the other, but it makes our lives a lot easier as we're trying to track applications and make sure that you've completed both. And, you know, we try to get in touch with people as the deadline's approaching. If you've completed one and not the other, we want to make sure that you're, you know, it's not too late and you didn't realize or something like that. So yeah, if you can use the same name and email address, it will make our lives easier and hopefully your life. We recommend starting with Sophus, and then as you proceed through Sophus, you'll be instructed to complete the UW Graduate School application, but it doesn't ruin anything if you start with the UW application. And then one thing to note with this program, only apply to one concentration from the HS-POP MPH program. So that would be the General Health Systems and Policy, Social and Behavioral Sciences. Technically, if you want to, the application portals won't stop you from applying to more than one. But, you know, there are 3 concentrations in one program, but it's one program. So you can pay multiple application fees and apply to more than one concentration, but there's no benefit. So please don't do it because we don't want you to waste money. All that being said, you are absolutely welcome to apply to more than one MPH program. So on that way earlier slide, I mentioned there's an online MPH program and the COPHP MPH and the epidemiology MPH. You can apply to as many programs as you want. Just in our program, please only apply to one concentration. And make sure that it's the same concentration on both portals, please and thanks. Right, so application fees and waivers. So I think it's easier to think of Sophus as your primary application and the UW grad school one as your supplemental application, just because of how much work you're putting into each one. So Sophus has a fee of $145 for the first program and $55 for each additional program that you apply to. And they do offer fee waivers, and you can find more about that on their website. Those are fully by the Sophus people. Please request these early. They only offer a finite amount of waivers. And I'm not sure about this past year because I was on maternity leave, but 2 years ago, Sophus literally ran out of waivers on our application deadline. And understandably, but unfortunately, a lot of folks wait until the deadline to complete their application because, you know, they maybe want to make a tweak here, keep editing. And then they requested their waivers after they ran out. So folks that otherwise qualified didn't get fee waivers, which makes us sad because again, it's already expensive. We don't want you to waste money if you qualify for a waiver. So I mentioned that December 1st deadline, but why not just get all that stuff in early so that you can get a waiver and be done with it. Okay, so the UW grad school supplemental application, the fee is $90. And there are fee waivers available from 2 different sources. So first, the grad school. Applicants must determine their eligibility for a fee waiver from the grad school before requesting from HSPOP. So first, check and see if you're eligible for this top one from the grad school. If you're not, then check ours and see if you're eligible for ours. And for this one, the way it works, a human literally sees your waiver request. You need to turn in the paperwork online, and somebody actually sees your request, goes in and pays the fee for you in the back end. So please do this at least 7 days before the deadline to give us humans time to get this done. Because yeah, these two, you know, in the end, when the deadline is approaching, obviously the more and more come in, and it can be hard to keep up with. Now, please do not pay the fee and then request a waiver because it cannot be reimbursed. So getting into SOFIS. So the materials here are going to be transcripts from every college or university where you've earned a degree or taken relevant coursework. There is a part where you'll order official transcripts, and a part that's really fun, the manual transcript or course entry section, where you literally have to look at your transcript and type out every course exactly as you see it on the transcript. It takes a lot of time, very time consuming, so get this done early. The nice thing here, you only have to do these a few of these parts, I'd say the first 1, 2, 3, 4 parts one time. Actually, no, sorry, 5. Everything on the left here, you only have to do one time. You don't have to redo all of this for every school or program you apply to. You just, yeah, you do these once, and then, you know, any other school on SOFIS will see the same thing. So that's at least nice. And SOFIS does offer a paid service where you could pay someone there to type in your transcripts every single course, but I would still recommend very closely checking their work because that's also a human. Okay, so next, we require 3 letters of recommendation. Like I said, these are important. These should come from folks that can speak to your capacity for success in the graduate program and to ultimately provide leadership in the field of public health. So they'll commonly come from academic sources like professors, mentors, or research PIs. They could also come from current or recent supervisors. And some folks will reach out to me and ask about those letters. Maybe it's been a few years since you've been in school and you feel shy about reaching out to faculty or supervisors. And I just always tell people, like, faculty are used to getting these requests. I think it's nice to help them remember who you are and what you did for them or with them, you know, refresh their memory. But don't discount yourself just because it's awkward, because the worst that they can say is either nothing or no. And the best that they will do is write you a glowing recommendation. And what you'll do is you'll just give us their name, I believe, title, and email, and then the system emails them requesting them to send in the letter on their own. So so yeah, they don't send it to you for you to then upload. It's a matter of them doing it themselves for obvious reasons, kind of. All right, so next you have your resume or CV. Make sure that's updated. And then you have the option of providing GRE scores, but please know that is so optional. We stopped requiring that during the height of the pandemic and then just never returned to it. We believe the GRE is problematic for many reasons, and yeah, just don't want to require it anymore. But that said, if you took the GRE and you want to share your scores, you're welcome to. And then if English is not your first language, make sure you check out the University of Washington Grad School's English language proficiency requirements to see if you need to submit test scores, or if your situation, if it's not required of you. Sometimes people will email me and tell me their situation and ask me if I think they need to provide those scores, and I might weigh in, but I will always just send you to this website because there might be something that you're not thinking to share. And I don't want it to be too late and for you to not have those scores and then have the deadline be approaching and have you be stressed out. So please review this website if English is not your first language. Okay, and then we have our written statements. So I'm going to dive into those on the next slide here. So first we have the, oh wait, no. Where'd they go? I moved them. Okay, I'll go back to the other side. Okay, so first we have the written statements that are required by the University of Washington School of Public Health. So these first two statements will be seen by any MPH program that you apply to at the University of Washington. So when you're writing you only have to write these once. So if you apply to online MPH or biostatistics MPH, we'll all see this answer. So you're not writing, dear this program, this is why I want to be at this program. These are the statements that are more about you. And then we'll dive into the program statements in a second. But first we have our personal history statement. So here you'll provide a narrative about your lived experiences, obstacles you may have overcome, and how these have guided you towards public health. Could be who you are as a person, your family or cultural background, socioeconomic conditions and experiences growing up, including successes, challenges, moments of learning and growth. This question is not intended to ask you to share personal information that you're not comfortable providing. And then we have our equity, justice, and anti-racism statement. Here you'll describe how you might contribute to our equity, diversity, and inclusion efforts and/or learn and grow in the areas of EDI and anti-racism during your time at the University of Washington School of Public Health and in your public health work post-graduation. And then now we have the statements that are specific to this program. So just the HSPOP MPH program. So here is your statement of purpose. This is where you have the opportunity to describe your education, prior work, volunteer experience, and/or professional career goals and how this program will help you meet them. So this is your big statement. Why are you going back for your MPH at this time? This is your big one. And then we have the optional academic preparation question, which I believe is being slightly rephrased. But basically, we're asking, is there anything that's not obvious on your transcript or resume that you would like to share? Oh, and one thing I didn't mention before, I have on all these slides linked in the bottom, right? The full application instructions. I know that these have been some wordy slides, but it might be even wordier if you look at our website, but if you want the full application instructions, find those on our website. This is actually the shorter version. Okay, so now I'm going back to, so that was everything on SOFIS. Now we're going to talk about the UW grad school application. So here you'll report prior schools attended. You'll upload a PDF of unofficial transcripts. If you're offered admission and accept your offer, then the UW grad school will request official transcripts, but that's not, you don't have to worry about that right now, just a PDF upload. So if you have it on your computer, great. If you have a paper copy, then you can scan that and upload that as a PDF. Basically, what makes it official is it's unofficial if you have it yourself on your person or in your computer. It's official if it goes from institution to institution. And then you'll share your SOFIS application ID on your UW grad school application and vice versa. Both applications need evidence that you have begun the other application before you can fully submit either, if that makes sense. Because we don't want you to accidentally like go through everything and again, not know that you have to do an entire other application. I'm wrapping up the part where I just talk at you. So why the University of Washington Health Systems and Population Health MPH program? We are training the next generation of public health leaders. We have a foundational commitment to equity, diversity, and inclusion. We have an extensive alumni network with over 1,000 alumni. Our curriculum emphasizes interdisciplinary study and work with small class sizes and active learning styles. Our faculty are leading public health researchers and practitioners with strong community connections. And we're part of the top-ranked University of Washington School of Public Health. We're regularly one of the top 10 public health graduate schools in the country. And Seattle is gorgeous. These are just a few pictures of Seattle. The one on the left is Rainier Vista, where we can see Mount Rainier from campus and our famous cherry blossoms. On the right, we have the Space Needle. On the bottom right, we have a picture of Puget Sound with the Olympic Mountains in the background and our famous ferries. It's a very cool place to live and work. I'm not from here originally. I'm from Ohio, and then I lived in Boston after that. And I've been here since 2020, and I do not want to leave. I absolutely love it. If you ever want to talk about ferns and moss and plants, I am here to have those conversations as well as just talking about the program. So let me know. And there are campus tours offered by the University of Washington. I have those linked here. We don't offer tours in this department or in the School of Public Health. Unfortunately, we just don't have the capacity to do that. But yeah, you can just go through regular University of Washington campus tours. And they do also offer virtual tours if you're not able to come here before applying. But yeah, it's an awesome place to be. Look at me, look how happy I am on the Puget Sound. This could be you. Yeah, so if you have to jump off before we go into Q&A, then I just want to make sure that you see my email. It's in bold here. It's hservask@uw.edu. You can send me questions anytime. I do my best to get back to you, if not that day, within a couple days. It all depends on the time of year and kind of how crazy things are, but I am your resource up until you submit that application. So please feel free to send me questions, even if you're just having difficulty navigating the website and finding details. I'm here for you. And you can also book an advising appointment if you'd prefer to meet over Zoom and you know, continue the conversation. I also want to encourage you to look at, we have news stories that we post about alumni, students, and faculty of this program. That can be a great way to research the program just for inspiration and just to see, like, we love telling stories about the cool public health work in the real world that our students, alumni, and faculty do, and celebrating them and giving them recognition. It's another great way, like on top of going to conferences, it's another great way to provide recognition. And we post those on our website and on LinkedIn and Instagram. We're trying to do more TikTok. We do some Facebook. And yeah, I encourage you to look at all of our socials for those as well. Lots of cool inspo there. All right, with that, I don't see any questions coming in. Does anybody have any questions? Please feel free to, oh, nope, there's one. Please feel free, as I'm answering these and reading these, type them into the chat, and I will take them as they come in. Okay, so this person says there's a question about funding, specifically the options for working as a teaching assistant or research assistant. Could we outline the application process for these opportunities? Require whether a specific IELTS score is necessary if this funding can cover full tuition for international students. Okay, so this is a multi-part. So after you are admitted to the program, then you are fully admitted and you have created your UW ID and you have a UW email, then you can start applying to these, to assistantships. And like I said, they're posted online. So they're all posted by different departments, and they might be posted by a faculty member, they might be posted by a research center. You could be a student assistant in an office in the School of Public Health. They're all posted by different offices. And I know the last part of your question, you asked about full tuition for international students. It's they all have different stipend amounts. So they would be detailed in the job posting, how much it would cover. All right, so next question. Can out-of-state students apply for state residency for the second year to receive in-state tuition? My understanding is that no, that is not allowed at University of Washington. You have to live in the state of Washington for, I believe, a year, not for the purpose of attending school, before you can get in-state tuition. All right, well, I don't see any more questions coming in, so but with that, I want to just say thank you so much for being here and for your interest in the program. I know you have a lot of options for your MPH. Hopefully this sounds like the right fit for you and your needs, but my hope personally is that the presentation helps you make an informed decision about whether this program sounds right for you and that you feel prepared to apply. So after today, please stay in touch. And yeah, you've got my contact info here. So I'm going to say goodbye and wish everyone a great rest of their day. Thanks so much for joining.